let's go a little bit broader than tobacco use, and I'm going to now turn to Dr. Rahita Samarathan from Sri Lanka, and ask a little bit more broadly how to promote the synergies across the response to both TB and non-communicable diseases, including tobacco use, but also other conditions, diabetes, and the other spectrum of nutrition, which is undernutrition, and other entities. And what are these Sri Lankan experiences in integrating prevention and care?
And particularly the Minister of Sri Lanka and of Central African Republic, because clearly there is a dialogue between health and other sectors, particularly the food sector, but the social protection sector. And that is the way really to address the nutrition challenge in the world. But I actually would like to ask a question particularly to the colleague of World Vision. I think Dr. Longro mentioned his guidelines on tuberculosis and nutrition. I have a couple of copies for those of you who want. But the next step is to develop some operational guidance. So I'd like to ask, in our operational guidance, should we mention the fact that actually providing foods to patients with tuberculosis helps the compliance to the treatment? What is your experience? Thank you.
With yesterday's opening and the opening ceremony, the Kenyan lady, the TB victim, she said the biggest problem she had was finding money. Especially she didn't have money to take the chest X-ray. In my country, we have practiced universal health care for over 7 decades now. So therefore, our health indicators are the highest in the region, especially the maternal, the child, or the neonatal health care is the best in the region. And also, we have the state look after the entire health of the nation. So we have about 20,000 medical officers, 30,000 nurses, about 15,000 paramedics, about 600 hospitals, another 500 primary health care institutions, and also so that is run by the state. And also now there is actually we are expanding the private sector also with the help of the government. So therefore the TB burden is not high in our country because it has been properly managed for the last 20 years. So the main problem is about the nutrition. You take actually diabetes. When you take diabetes, actually like globally, in my country also, we have about 70% of the deaths in the hospitals are due to NCDs. Out of NCDs, the leading factor is the diabetes. So diabetes patients are 3 times more prone to TB. So therefore, now we have set up to overcome the NCDs, including diabetes. We have set up 842 healthy lifestyle centers in the around the country, and 946 well-women teams. That is because all this time all the curative services were free, preventive services were free, but there was no way for a patient to go and do a checkup. Only the private sector was available. So the poor people didn't have money to get the checkup. So they go to the hospital for the first time only for treatment. That is why I set up this healthy centers all over the country where we do the basic investigation, the BMI, the blood pressure, the sugar, cholesterol. Then we refer the patient to the nearest hospital. And also in the well-being clinics, in addition to those tests, we do for the breast cancer and the pap smear for the cervical cancer. So, and the other problem is the obesity among children, especially. So the main reason is the sugar. Today, a lot of promotion from the private sector sugar product. So therefore, in 2016, last year, we introduced the traffic light system. Up to 2 grams per 100 cc's, we set green. Between 2 to 11 grams, he said amber, over 11 was red. So even the multinational companies, all the beverages went red, and their market came down drastically. So they had to reduce their sugar consumption, sugar content by 10% to bring down into the amber. So therefore now this time, this year 2017, we have introduced the tax system for all the sugar beverages. That is, every gram of sugar has to pay 57 cents in my country, right? So there are some the beverages having 1 liter bottle has about 110 grams of sugar. So they have to pay about 55 rupees additional to the bottle. So that will bring down the actually consumption of sugar products, or the sugar, those beverage producers have to come down their sugar content. And the other problem is the underweight among the children, especially among 2 to 5 years children. In 2010, we had about 30.5% of children were underweight. But with all the universal health care, we have brought down by 2014 that to 19.3%. Then the other problem is the alcohol and drugs, especially when the breadwinner is addicted to alcohol, drugs or tobacco. Then the problem is the economics of the family. So all the other nutrition levels will come down among the children and all that. So therefore we have actually we have for the malnutrition, we have set up the program called 3 Portion. 3 means the trial, Portion means nutrition. 3 types of nutrition, that is soya, maize and milk powder. Mixed together a nice, very tasty product. So we cater to 1.3 million population. That is the pregnant mothers, all lactating mothers, and malnourished children. And this year we started for TB also. So we give this all over the country, 1.3 million people, 2 packs person, 750 grams, 2 packs, that means 1.5 kilos per month to everybody. So we distribute 2.6 million packs like that. So the other problems actually is that the tobacco. Tobacco, we have taken a lot of drastic actions on tobacco by Sri Lanka. So we are this is the primary causes are the lung cancer, the chronic pulmonary diseases, and those things. About 20,000 people die because of tobacco in my country, about 60 people a day. So therefore, 24% of the males are tobacco smoking, only the ladies 21%. And now it is coming down with the measures that we have taken about by 4% annually. So we have actually, we are the first in the region to sign the FCTC agreement with the WHO, and we have banned actually smoking in public places. We have banned advertising, and we have put 80% pictorial warnings in the package, and also the tax was earlier 70%. Now we have increased it to 90%. That is the highest in any part of the world. And also now we have, I have taken the paper to the cabinet to ban selling of cigarettes around 500 meters around schools. And also I am going to bring the plain packaging also of that. And by 2020, we have informed that all the cultivators that the tobacco cultivation will be banned. And also the other problem is about the pharmaceutical prices. It was very high in the private sector, so we have brought it down by enforcing maximum retail price for 48 generics. So 48 generics means it affected about over 400 brands. So out of 48, 16 drugs are NCDs. So therefore, our drug market is annually about $400 million. So we have brought down all the prices. We have brought down very heavily the prices. So, and also we have started manufacturing our own drug. There is a state corporation. We have doubled the production from 2 billion to 4 billion pieces. And also I have signed about 46 agreements with the local and foreign investors to manufacture drugs here. So therefore, we have, every day we have actually taken measures to reduce the NCD as well as tobacco, to bring down the TB. So therefore, we have controlled TB in a reasonable manner, and we are the best in the EU. And we have our primary health care very well extended to all the regions. And we had problems earlier because there was a conflict for 30 years in the northern and the eastern provinces. That area also has been liberated from since 2009. Now the entire health system is being operated there. You must remember, even during the war, our immunization programs 100% in my country. Because even the terrorist organization, they agreed for a 2-day ceasefire every year for the immunization and other health. Even the programs on TB during the civil war period also, they cooperated with the government missions, and they allowed all our health officers, our health volunteers to go along, sometimes with the WHO, with the Global Fund people, ICRC, Red Cross, all those people to go there and work. During how much our population is, the awareness among the health. The best example is when the North and East was liberated in 2009. About 300,000 people marched from that area to the liberated area. News. Everybody, some people, they didn't have their birth certificate with them, but everybody had their immunization card for their children. So that is how the health is so, the awareness in the country. So therefore we are spending enough money and the awareness is there. So that is why all our health research are highest in the region.
Thank you.
Because our the health is given very prominence, and also the awareness is very high. That is because even our education is also totally free. As I said, that all the children are given the health insurance for the university students in all sectors. More than that, all the students are, because have been made compulsory that they have to get the education. Up to the secondary education has been made compulsory. And all facilities are being given to the children, because every year a set of uniform is given to the entire student population. Then the set of books given to them. And in the poor poverty region, the poor students, a pair of shoes being given. And even there are, in the poverty region, actually a glass of milk is being served. Like that, so we get the entire children for education. With that education system, because of that, we are about 97% literate. So the sending the health messages, even preventive work, is been very much easier because all the people have a basic education there. So therefore, and most of them, even to take agriculture, now we have given very high prominence to agriculture because to reduce poverty, because that will help in another way the health, like education, giving more education, giving more awareness. So that means they will be more conscious of health. That way, most of the things, because we have given the highest priority for health and education.